Video around the RITA program. This video is focusing on the implementation of the RITA program, looking specifically at community integrated risk management and how the principles of resilience have been applied in the Americas as part of this program. We're looking at a series of activities that are conducted in about 10 countries starting early 2013. And as we explained in the first video, it's part or resulted from a long discussion about what is the Red Cross role and added value in building resilience at community level. And we reached this agreement around a resilience formula in RITA around these different levers of resilience, where we as an organization help contribute around knowledge, organization, connectedness, and the access to external technical skills. So these different skills, or this different approach, helped us to examine what can we do to help the community be more knowledgeable. This is really at the individual level. It's building that human capital, making sure that individuals have the knowledge to understand and address local shocks and stresses. A lot of this information is about, first of all, understanding what is the situation in the community initially, carrying out a baseline, looking at secondary data, what is happening in that community, and then having these participatory appraisals to identify the main risks that people sense or are affected by on a day-to-day basis, and design the Red Cross intervention to build community knowledge and change risky behaviors through training, for instance, on proper hygiene practices, or as well on proper household disaster preparedness behaviors, or could include measures that improve child and maternal health. So let's look at some of the actual achievements that have happened. None of these are comprehensive, but it gives a bit of an idea as to what has been some of these successes of the RITA program. If we look at Colombia, it's just as one example among many others of how a community, through the access to first aid training, is able to conduct simulation exercises. Or in the case of Ecuador, every household is developing its own family disaster plan and knows what to do in the event of a flood or a storm or so forth. A third example from Peru is how training has led to a strong mobilization around key health messages to reduce the outbreak of different diseases in the community. In Nicaragua, this community focus identified the quality of water as a challenge and how to treat water, filter water, within the contribution of Red Cross in terms of provision of filters. That's the knowledge part, but then when we go into the community as a whole, the focus goes much more on cohesiveness and organization. How can we help resilient communities, or help the communities become better able to identify their problems, establish their priorities, and act? A lot has to do with the mapping of community stakeholders, engaging local leaders, carrying out the VCA tools as explained in the first video about identifying local challenges, really building a consensus around the local priorities and designing a community action plan, coming up with a community-led process to identify what the priorities are. So the slight difference perhaps from traditional sector interventions is that the process is as important as the outcome, meaning that we want to build trust and reciprocity, a sense of community, civic participation, social support. People must feel they're a part of the community. We want to build this community cohesion as we work through the different sectors that they consider important. And from there, we try to support interventions that helps them build their own sense of capacity and ability to get things done. So some of the examples that we have from the RITA project, again, the second example from Colombia, as was done in all the communities, a mapping process. Let's draw a map of the community. The map in itself is a process that helps the community interact among neighbors. Sometimes the neighbors don't know each other, especially so in urban contexts. We want them to be better able to understand that they have common challenges. It's not as much about the collection of information as it is about the collective agreement on the way forward. Another example that we can take, for example, from Salvador, is how the community, once it had its community priorities and identified flood risk as a problem or storms as a problem, actually worked together, collected used tires and built an evacuation route. Here, the substantial result of this process of working on DR is better organization via a tangible micro-mitigation project. And our resilience is enhanced through this better organization. Taking another example from Ecuador, the community identified that there was a vacant lot that was used or misused with the, for garbage disposal. What they did is cleaned it up and then working with partners, were able to collect, again, tires and build a park with some support from the Red Cross, and actually led to this area for kids, really giving value to what is otherwise an empty lot. Another example from Belize is the community identified solid waste disposal as a problem. They conducted massive cleanup efforts, and the Red Cross contributed with the provision of some bins, and the community helped install them through the mobilization of its local teams. Now, all this is really helpful, but quite often we stay limited at the community level. What RITA really tried to emphasize is say that a lot of the topics that come up are not necessarily something that neither the community can do on its own or the Red Cross can support. It really requires external expertise and linking up with other partners. We really want our communities to have these relationships with the external partners. We can provide the wider supportive environment. So some of the components of that is the mapping. Mapping of external stakeholders is extremely important, not just part as a key component of the RITA intervention, the RITA approach, or as part of many of our traditional sector approaches, but it actually has led the groundwork, laid the groundwork for the coalition approach that we'll talk in the third video. So once we have this mapping of external stakeholders, we get them involved, they're part of the training, and we make sure that the action plans of the community are shared with them, that the external stakeholders are part of this process. This then allows joint projects between the communities and the partners, quite often even without the Red Cross, and the partnerships allow these key stakeholders to play a key role in addressing community needs. And then the Red Cross plays a strong advocacy role throughout the RITA countries towards external decision makers when we don't get enough leverage through this initial partnership model. It also includes, obviously, humanitarian diplomacy in the events where what is identified by the community is something that goes beyond its ability to deal with it around humanitarian challenges. So looking at some of the examples that we have from the region, in the case of Costa Rica, a community was cut off, living quite a distance from the main access route, limited transportation. The Red Cross worked as a convener, and the convening role has been really important in RITA, as a convener to help the community sit down with the transport companies and reach an agreement as to the rate and the service for a bus to come by that community on a daily basis and help that community access the closest urban center. Another example, again from Costa Rica, is another community. A dengue outbreak was addressed not via the provision of Red Cross intervention, but a partnership between the community, the Red Cross, and the Ministry of Health, where the Ministry of Health personnel joined forces with Red Cross volunteers and community volunteers to go door to door to ensure that all the risk factors related to dengue were addressed and completely eradicated dengue in that particular community. Another example of the Red Cross really playing this convener role in establishing partnerships is in the construction of this park, where the access to tires in Ecuador and in another similar project in Colombia was made possible through the contribution of local foundations and private sector partners to make this project a reality. Further projects where the Red Cross has played more of an advocacy role in this municipality, in this particular case in Huaquillas in southern Ecuador, was making it more feasible for people to legalize their land tenure situation in areas where of recent settlement and make the municipality more aware of the flood risks in those particular areas. So the municipality has played a key role in helping guide these families to establish or obtain land title for the lands that they're occupying in that particular context. An example from Belize as well, where the Red Cross played a role not only in the installation of bins, but realizing that the garbage was not being collected even after the community cleanup efforts, played an advocacy role to the municipality to ensure a more regular collection of trash for that community. So all this has led us to a series of interventions where we're supporting behavior change, mitigating risks, supporting local action through small grants or the donation of equipment or filters, but really as well taking on a more active role as a convener, facilitating partnerships and advocating on behalf of the community, going a bit outside of the realm of the traditional project approach, while at the same time using our sector interventions around water sanitation and hygiene or disaster risk reduction or health as entry points to the community to enhance the community organization, to enhance the community knowledge, and this connectedness with these other partners who are perhaps better positioned than the Red Cross to address this. So recognizing our own limitations as Red Cross and seeing that there are a lot of other partners who really play a key role, and even if the Red Cross is no longer involved, these partners are still there and are able to continue this process. Some of the conclusions from this process has really been, first of all, that the assessments are as important for building cohesion and local capacity as for the information collected. This is particularly true in urban contexts where the information is already available in many cases. We don't need the community assessment to know what the situation is, but the community assessment is what allows the community to organize itself and then be able to address the situations on its own. Another conclusion is that really resilience is a journey rather than a destination. Back to the point in the first video, whether this is resilience is an outcome or if it's a process. In RITA, it's really come across as a process of building social capital rather than achievable end states and ideal 6 characteristics that all communities will have. How do we help communities being able to build that social capital through these community groups on a daily basis and achieve local successes on their own? The third lesson we could take away at this early stage is that really RITA has been an initiative in which national societies take great pride for their achievements, but which they are unable to replicate. It's still a costly investment for national societies, and they require this external support to be able to carry it out. And the last point would be that the RITA has really led us to a profound transformation of the Red Cross away from a traditional project management role and really taking on a much more of a convener, facilitator role as a trainer, a coach for the community, and linking that community up so that it has this knowledge, this organization, and this connectedness with other partners. Join us for a third video, which looks much more into how we, as we consider the future of RITA, are looking at how we can sustain the momentum and reach scale in these interventions.